Thank you for being here. My name is Kathleen Beckman, and I am chair of the Pinellas County Continuum of Care. And I am so grateful that you all came out tonight to learn more about St. Vincent de Paul and attend our CoC general membership meeting. I can't say enough good things about Chrissy Bond and the St. Vincent de Paul Soup Kitchen here in Clearwater. It is like walking in to, I think, a big comforting hug when you come in here. I've done some volunteer work here. We did the pit count here out in the courtyard, and have been here with Chrissy when they've had graduates from different programs. And it's just a wonderful resource here. And they're good neighbors in Clearwater, which is important too, because we're here in a residential neighborhood. So thank you all for attending. I could go on a little bit more about St. Vincent de Paul, but that's part of the agenda. Chrissy's going to share that with you. So thank you all for being here, and I will turn it over to Chrissy, who will welcome you as well, I'm sure, and tell you more about what they do for our community and the entire county. So she's a provider. They're part of our providers in the county, and it's important that the CoC, I think, comes out to our different providers throughout the county to show who's doing what, where, the diverse needs and the diverse resources, and how we, all that partnership and that interwoven connection of people lending a hand and doing this work is so important. So I appreciate, here's Chrissy, our director of St. Vincent de Paul.
So welcome. I'm so glad to have y'all here. And I appreciate everyone who went on the tour. I hope you liked it. So I don't know how much you know about St. Vincent de Paul, but up in Upper Pinellas, we have the St. Vincent de Paul Council of Upper Pinellas. And that includes the community kitchen right here, and then our thrift store on US 19 near Old Coachman. Bernice is the manager, and she's greeting everybody at the door. And then we have 8 conferences that are attached to Catholic churches in the area. Those conferences receive donations from their parishioners, and they use that toward rent and utility assistance and providing furniture and bedding at no cost to the residents in their area. And we're doing that between about $50,000 and $100,000 a month. We're providing in rent and utility assistance to keep people housed. And at the thrift store, the profits from that go back to the conferences to support them and back to the kitchen to help those we serve here. So they provide a vital resource to us. So here at the kitchen, we operate 7 days a week, 365 days a year. We start showers at 7 in the morning. We provide a hearty meal from 8 to 10 in the morning. Anyone who walks through our doors is welcome to participate in either. We provide clothing, emergency hygiene items, and any other needs that people might have, you know, insect repellent, sunscreen, the hazards of living outside. So we provide those along with the showers. When people take showers, we like to provide them clean clothes. And while they shower, we wash their other clothes so that they have fresh clothes. We provide the meal every day. We average about 100 people a day. Over the past few years, our focus has changed. We've been around for 40 years. And so for about the first 35 years, we fed and then began showers and then gave hugs and said goodbye. And that's our board realized we need to do more. We want to change this situation, and we want to help people get housed. And so we have moved toward that in a much greater capacity. Part of that is working with Clearwater Police Street Outreach. Kathy Ham was in here. She's here every day in the kitchen. We meet with clients every day and set them up for referrals to Pinellas Hope and Safe Harbor, some sober living facilities, detox facilities. We work with each person to determine what the issue is that they're struggling with and help them devise a plan to overcome. And so we really enjoy that, but each plan is different. Now here at the kitchen too, we also receive funds from the city of Clearwater for diversion, where we will buy plane, bus, or train tickets to return people back to family or friends, or a program that they've found that will help them overcome their situation and find a new hope. So we do a lot of that. We also deal with people who are found on the streets and have absolutely nowhere to go. So we will place them in a hotel until everything stabilizes. We get them in the system and get them on the list and then get them moving forward. And prior to that, police officers here in Clearwater would pay for hotel stays, especially on the weekend, out of their pockets, because they weren't going to leave a mom with children on the street. And Kathy Ham brought that to the city and said, this is a real problem. You know, they shouldn't be having to do this out of their pocket. And from that, they started providing us grant funding for that purpose. So, trying to think what else. Deacon Scott, do you have anything else to add?
What are some of your biggest challenges?
Housing. We can't get people unhoused if there's no house. So we need housing. And I've spoken to the council about it many times, that we have learned through our senior services programs, where we provide nutritional supplements to senior citizens and high quality vitamins and emergency supplies and gear, that about half of the people we serve are senior citizens, and they receive Social Security. They go into a hotel at the beginning of the month, they exhaust the funds, and then they sleep on the street till they get the next check. And that is a real problem, because we're not going to employ an 80-year-old homeless man. It's just not going to happen. So we have to meet that need where they are. We can't expect them to come up to our market standards of housing. And so that's a big problem. And then there are others who receive Social Security disability that will never support them, and that we also can't get employed. And so that's the biggest challenge. And we are working hard to bring more housing. And I was at the Affordable Housing Advisory Board meeting today, and the city recognized that they need to change this, that there needs to be more affordable housing, and they need to be part of the solution. And I'm not saying affordable housing where the rent is still not affordable. We're talking about legitimately affordable housing. So that's what we're working on. Does anybody else have any questions?
You said the hours have changed. They're now 24/7.
The hours here?
Yes.
No, it's 8 to 10 in the morning every day. We start showers at 7 because we wanted people to have more people to be able to shower. We don't like to turn people away from showering. So that we double our capacity with the showers, and we start them at 7. But the meal is 8 to 10 in the morning.
And that's Monday to Friday.
Every day of the week,
That's
every day of the year. So everyone can count that we will be here any day of the year, except for the hurricane.
And that's
And we did start serving meals before the power came back on. We did it in to-go boxes because we didn't want people to not eat.
And it's the 8 to 10.
Yes.
I was wondering if you were entertaining any new strategies or anything in order to create a home, a place where someone with lower income could actually afford. You know, I mean, I know there's not a lot, but is there any?
There are some strategies that are being considered, like homeowners being able to rent space on their property. And I know in St. Pete that's being done a lot. Kathleen, you probably know more than I do about this. But the city of Clearwater is also very open to that. And they're looking at the properties that they own that aren't being used. And they're actually reaching out to developers to see about what can be done, you know, with different kind of structures, so that people can be.
This area is like one of the most popular places to move in the country right now, and the rents are going through the roof. So even if you got a good job, it's hard to afford it. I was just wondering, you know, how are you going to remedy that? That's a big problem.
It's a big problem, and for us, that's why we send a lot of people back home. If you come here and you think you're going to sleep on the beach for a few weeks and you're going to work and then save up money, first, last, and security is a lot of money.
Yeah.
And it's just not that easy. It's way too expensive here. It's not like it used to be.
And if you ever had an addiction, then you're not even running, right?
Yeah.
So,
Yes. And that's what I've told the city. If you do not want to see people sitting on the benches in the parks and homeless, we have to solve that. They're not going to be able to solve that for themselves.
They're like, it's a gentrification process, and the rent is going up, you know. Yeah. You haven't, still getting reported.
How frequently are you seeing any families with children here at St. Vincent de Paul?
What would you say? A few times a week?
It varies from time to time, and a lot of them like don't have their call it. They'll call it their phone. So we had a lady here yesterday, pregnant. But
Yeah, a lot of times they reach out to Kathy or officers find them and then send them here. So, and then we immediately meet with them and, you know, help them figure out what they're gonna do.
Families are more often sent to other programs that are children friendly.
Yes.
Yeah.
Yeah, but we have a wait list, you know, for housing and our housing providers are great. They're responsive and they're doing everything they can, but we're limited.
So then when those families do come, then we screen them. We do the BS for that immediately, put them on the shelter wait list. We try to start working on barriers and stuff. And then we do present them to the county. Especially if there's extenuating circumstances that we need to get them up on the list on as a more of a priority. And then we do other things sometimes. The city does on occasion force Clearwater residents only provide us some funding through Chrissy that we could do very short term hotel stays while we're waiting to get things into shelter. So that those children, frankly, I know the priority is the ones that don't have vehicles. We don't even want to see kids out there in the vehicle, but at least they have a locked door, air conditioning, that kind of thing. So, but we staff all of them, but the priority are the families of the city of Clearwater that don't have an actual safe place to be.
We had a family living in an SUV, and one of the school teachers of one of the children reached out to us and said, he hasn't bathed in so long. Is there anything you can do for him? And we ended up, I ended up having them come 3 times a week to the kitchen after school and made dinner for them so they could all sit at the table and eat, and had them all shower and wash their clothes. And, you know, and gave them that time. And it made for a very long day for me. And I remember the mom saying, the girls want to do track, but we're not going to do it because I don't want to make you later. And I said, let the girls do track, you know, let them do whatever they want to pursue. And she did. And it was so painful to watch them walk back out and climb in that SUV knowing they were going to be sleeping there. But eventually Salvation Army picked them up into a 2-year program, and it was wonderful. And occasionally she'll still reach out and go, can I come grab some food? I said, of course, you have 6 kids, you need food. But at the end of that time, they came for 6 months, they were in their car. And at the end of the school year, she invited me to the end of the school year performance. It just happened that I was going to be out of town, so I couldn't go. But she sent me videos of her daughters dancing, playing violin. It was just amazing. What an amazing mom. But it was quite a victory. Yeah.
Tell someone in that situation to go park where they'd be safe, where they would be harassed by police or, you know, trespass or something like there's somewhere safe where they could go park. That's unfortunate.
We've approached that many times. We've
Right,
asked
so-
for that.
Unfortunately, they're not harassed by the law enforcement. There is a law. And law enforcement are to do that, so it's a budget. So
Yeah,
if they're private areas, they're not. Now, we will approach them through me and ask them if they know that there's an alternative or being in a vehicle. But as far as us being able to, at this moment, advise them where they can park, well, I can't do that. Because there is, at the end of the day, a state law in
sure.
regard to that, so they're not
Especially the
harassed.
children.
But
And
they
to me,
do-
sleeping in a vehicle with children isn't acceptable. We need to have
Okay.
housing.
But law enforcement officers in the city of Clearwater are all versed in what, services are available and know exactly how to reach out to me. I don't work 24/7, but I am available to them, so I get a lot of emails and stuff, so it's a little different.
I've probably been in every homeless shelter in Pinellas County and some in Colorado, but my daughter was going to Seminole High. We ended up in a shelter in the Clearwater Largo area. And they did accommodate her to where a bus would pick her up and take her back to Seminole High School. So she didn't have to go through all that stress of going to another high school.
Yes.
Do they still do that?
They do still accommodate, because when we put families in hotels, they will still accommodate to get them, yeah.
But at least she got to go to Seminole High School, for quite a while, because she had started there. And so they still do that.
Right,
Mhm.
as long as
Yes.
it's not within 2 miles.
Yeah,
That also.
yeah.
Not within 2, and then it can be as far as how many, I can't remember. 20, it's 20 miles, because I did a search the other day. for somebody.
Yeah, and
It's
each
20.
school is different. Goes with it. I mean, they are very good within the county about getting Ubers for the kids and just all kinds of stuff. To make it work, to keep that, continuity with their school. They need that, Ubers, they're building the school.
Are there any other sources other than 211 that helps providers with housing? Because providers have been taken off the 211 list for minute reasons. So are there any other sources of income or funding for rooms available to provide rooms to the homeless? Other than the 211 pot per se,
Not that I know of,
only that one?
yeah. And Pinellas County provides a list of, affordable apartments, and I make copies of that all the time and give them to people, but their definition of affordable is different than my definition of affordable. Even to qualify for many of them, they just don't have enough income. So, and if you've had an eviction, that's pretty difficult. Were you gonna say anything?
Split pad is a good resource, for home sharing. It actually does have some decent affordable options on it. It's called splitpad.com. We've had some success with people using that. You really want to vet the listings that are on there. But I agree with you about sometimes the listings that they offer are not really affordable. I've seen actually better options on splitpad for this area.
How long does an eviction go against you when you have an eviction? Is it 7 years?
That's what I understand on your credit report, just like, other claims, yeah. Yeah, and our conferences help a lot with that, with keeping people from becoming evicted. I met with a mom, she was pregnant and she had a baby in her arms and they were going to be evicted, and the conferences pooled their money to prevent that. Because I told her, I said, it's like a scarlet letter. You don't want that. So let's avoid that.
So many options for people to rent, they don't have to rent somebody that eviction, there's somebody looking to have it,
Yeah.
they can be.
Yeah, we just recently worked with a brother-sister couple to get them approved for an apartment, and I've never seen so many hoops in my life. They even, because we filled out the application and there was 2 of us, me with another program, and we each filled out different portions of the application, and then we had to go out and run outside to the officers and ask them if they would witness our signatures and then giving us permission to help them fill out the application so we could get it approved. I mean, it was just like, they would notarize, well, we got sheriff deputies here, and they witness us, they're giving us permission, and they did, and we were able to pull that off. It's just like, man, we're getting inventive, but I mean, I've never seen anything like it. I mean, 3 times the income.
Yeah.
And it makes it so hard when the average income for a person that's retired is about $947 a month. And we have a lot of people out here that are way less than that. Some that owe back child support so that their income is about $600. People won't touch them. They just absolutely will not touch them, so.
And the Clearwater Police have been invaluable to us here at the kitchen, because anytime I need somebody at the Greyhound station or the airport, they transport them. They gladly show up, they take them to detox and rehab for me. And we work hard with anyone who wants to address an addiction issue. So if they want to go somewhere, I will work to get them in there and then I will follow up. I will go visit them. I will bring them cigarettes. I swore I'd never do that, but if that's what keeps them calm and happy, I will buy them cigarettes. And Kathy and I visited one young lady and we brought her cigarettes, Mountain Dew and chocolate. And she stayed. It had to be the good cigarettes.
It was had to be specific and Glenn would be like, oh.
But she stayed there till she died with dignity. She wasn't on the street. So it was painful, but we were glad.
To tell you that your income has to be 3 times of what the rent is.
I don't know about that. It's demanded all the time.
It's a property.
Yeah.
Well, that's it.
As we know, there's a growing issue with people having mental challenges.
Yes.
that Resulting in them being homeless.
Yes.
Do you have access to mental health professionals within the scope of this services you offer?
Well, we work to get them referred to PEMS and to Directions for Living, you know, and they're receptive, you know, we do our best. They have to be willing. That's the biggest challenge.
Yeah.
You know, and we bought medication. If they couldn't get their prescription, you know, we'll do what we
Can't put
can.
background services on anyone,
No.
but I was just curious, I've never been up here.
Oh,
So,
welcome.
We have a lot of people that will seek us out. We had a guy down on, US 19 one night that was playing frog out on the street trying to get ran over. I said, well, you wouldn't try too hard because you're here to see me today, right? So let's stop doing that. And he wanted to be Baker acted. So we called for an officer and he came and he talked to him and we didn't have to do a Baker Act because he had a plan of killing himself. But he voluntarily went, so they were able to get him into that program and he shows up and for like a month, we didn't see him and we worried, but before he left, he gave me his lighter. And when first time I ran into him, he had rubbed a cigarette and I handed him his lighter. He was like, oh my gosh, you remember. But I carried that in my pocket for a month till I saw him and then put it back to him. But they will actually come to seek us out because they know that they don't have to have that Baker. They can actually voluntarily turn themselves over to a hospital for treatment and the officers are going to drive them over. So that's a big bonus that we have.
It's just that it's in the scope of my duty increasingly, and there seems to be more and more with some kind of specific mental challenges. And it's walking on broken glass, trying to refer them to get them to seek the proper help that they need.
The first step for dealing with mental health issues and addiction issues is a bed in a safe place. It's the first.
Because they're admitting to that kind of, seeing a doctor about a mental issue, that opens them up to other programs that they would now be eligible.
I have someone who's been sleeping outside who I offered a job today and I said, start on Thursday and I'm gonna put you in a hotel tonight and I just want you to sleep tomorrow. Just want you to rest. And he said, I slept 3 hours last night because I kept hearing something and I didn't know who was coming around. And yeah, he came in and worked all morning so hard and did such an amazing job. People need sleep, they need safety.
Also say that Evra Healthcare does have fantastic mental health resources and group case management and my experience working with them. So consider Evra as well, and they have offices all over the.
Evra,
EVARA, Evra, absolutely, right over here on Mulvey and Clearwater.
have to have insurance?
It's free for Medicare and Medicaid, it's very good sliding scale for ACA or private insurance. And then I also neglected to mention, I mentioned pad split earlier, I always pay the membership fee, which is worth it, it's $19. If that's a barrier for anyone, you can reach out to the Recovery Epicenter Foundation. We will pay for that membership fee if you have somebody, if that's the barrier. That's it.
All right, we good? Thank y'all.
Thank you, Chrissy. That was very informative and heartfelt. I would echo two things. One about mental health and wraparound services. And to me, with my work with the CoC and all the providers who are experts, it seems like anyone who has experienced any threat or actual homelessness has experienced trauma that probably will never leave them. And so I think that's something I carry with me inside, that I think I can imagine what I would have experienced. But I'm sure it's something you never forget and need to deal with. The other thing that Chrissy mentioned that I would echo is housing first, which is a philosophy of people can't deal with getting clean or getting sober or dealing with challenges or getting stable so that you can get out and get a job and get skills and maintain that employment and get housing. And that housing first philosophy is one that I strongly believe in, and it's one that's being questioned. And so we need to be aware of that and advocate for housing first. I think all the studies and statistics prove that works. It's important. The other thing is, there are headlines every day about Medicaid funds being cut and challenged. So be aware of that. I'm part of the advocacy committee. I'm co-chair of the advocacy committee as well as chair of the CoC, and that's kind of the segue into this part 3 of the CoC overview, which is to just mention to you and give you a little bit of an understanding of the different committees and councils that we have on as part of the continuum of care. So I'm just going to start by asking for all of you that are here, and it's a great turnout, how many of you are not a member of the CoC? Okay, that's a decent number. All right, well, thank you for being here and learning more. So the CoC stands for Continuum of Care, and we have a continuum of care in Pinellas County. We are a large enough county that it qualifies to be its own continuum of care. Some more rural parts of the state or the United States might have multiple counties that make up a continuum of care. But Pinellas County, and we're the most densely populated county in the state, has our own continuum of care. It's mandated by the federal government, and we're kind of managed or oversight through HUD, Housing and Urban Development. And I won't go into the other nuances, but our task is to work together with community partners to reduce and prevent homelessness. And some continuums of care have smaller boards and people that sit around the table and talk about what are we doing in our continuum, where are the gaps, what's our strategy, and how are we going to operate. Ours is a pretty robust continuum of care. And so our continuum of care has a board of directors who meet every other month, and I'm chair of that board of directors, so I just run the meetings. And the members of that board of directors include the sheriff's department. So the Sheriff Galtieri has a position there, but he sends a representative, Lieutenant Zach Hayes, who does a great job. Public Defender's Office. We have entitlement communities. So those are large enough cities in the county. So that would be Clearwater, St. Pete, Largo, and Pinellas Park that have a large enough population that they have an elected official that sits on the board. Also, the county has an elected official that sits on the board. We have providers. Those are the people like Directions for Living or PERC or PAR, CASA, St. Vincent de Paul, all those kinds of providers that will represent people who actually touch the lives of the homeless every day in their work. And then we have funders, and we don't have enough funders, and we need to be in the ear of funders. So funders are where we get our money. So the CoC doesn't get the money. We don't have treasurer, we don't have a bank account, we don't have any of that. But what we do is that group of professionals that have full-time jobs, so a county commissioner, a city council member, Lieutenant Hayes, all April Lott with Directions for Living and Kevin Roll with Bowley Center. All those people have full-time jobs. But we help make decisions about what's needed in our community. And we contract with, or we have a memorandum of understanding, which we have to be working on now, tightening up, with a lead agency that is the Homeless Leadership Alliance, which is represented here by their interim CEO, Sherry Holzberg. Yes. Yeah, Sherry. Volkswagen, sorry. And Megan and Victoria, who are with the HLA, who do that work. So they are paid. That's their job, and they manage our strategic plan and our goals of that continuum of care. And then part of that board of directors, so that's all the people that are kind of up here, right? They're professionals in the field. Oh, I didn't talk about the funders. I kind of left off with the funders because they're really important. So the funders are those, is the county, St. Pete, the entitlement communities, Clearwater, Pinellas Park and Largo, help put money in to help fund the work that they do. But there's also the Pinellas Community Foundation. There are different foundations, Juvenile Welfare Board, and we need more funders. And there's never enough money, like you said. But we also, as residents, people who live in Pinellas County, need to have our voices heard to our elected officials who hold the purse strings to say, I want more money to go here. We need more money to go to help our elderly who are, showing up more and more in our homeless shelters. So there's that board of the CoC, and they're kind of these appointed elected positions. And then there are members of the CoC, the general membership. And the general membership is anybody who wants to join the CoC. And it's a sliding scale. I don't think we have the list of the councils and committees out here, but if you're a person who's experienced homelessness, you have lived experience, you don't have to pay anything. If you're just a community member, what is it, like $25? $20, plus there's a sliding scale and there's a scholarship. If you want to be a member and you can't afford it, say, look, I need a little help. Can I be a member? And absolutely. Businesses can be members. It's one of my goals is to have more faith-based leaders become members and sit at the table. And so while you might not be on the board of directors at those every other month, pretty important meetings, you can attend those meetings and you have a voice. You can speak during public comments if you want. You can attend any meeting. These wonderful councils and committees are open to the public. Most of them are recorded. Are they all recorded? Almost all of them? They're recorded, aren't they? I think they are, yeah. I mean, so anyway, we need you. We need your voice at the table. Our philosophy is not about you without you. We have really been intentional in our lived experience advisory committee. The co-chair is Gary Small here of that committee, and they need to be at the table at all times as we are making decisions and discussing. So I went through kind of the Funders and Providers Council. The Advocacy Committee is one where I'm a chair, co-chair with Anne-Marie Winter, who is the CEO of the Area Agency on Aging. And so she and I are co-chairs of the Advocacy Committee. And what we do is we look at legislation that's being passed. We may write a letter to our legislators from Pinellas County to advocate for certain things, funding primarily. Please don't cut funding to things. We may write a letter on behalf of the CoC about the anti-camping legislation that was passed last year. We were not in favor of that and spent all last summer talking about how we might handle whatever might present us with more people being arrested possibly. So that our worst fears didn't really get realized, mostly because we had 2 hurricanes back to back and other things were drawing attention away from law enforcement. But anyway, those are some of the things we advocate for. We have a data systems and performance committee. If you're interested in really numbers and data about what are we seeing as far as homelessness related to families or veterans or women or elderly, any kind of trends, you can be part of that committee. And again, you can visit, you can sit in on any of these committees just to get a feel for them before you even join, if you just want to see what's this all about. The Lived Experience Advisory Committee is just as it sounds. It's someone who's had either experienced homelessness or been part of a homeless situation within the last 7 years, is the Lived Experience Advisory Committee. Our Point in Time Planning Committee is a huge committee and very important. I know Victoria heads that one up and is always asking for volunteers. It's not real active right now, but boy, it's real, it hits the ground in the end of January. And that's where there's a national day where we go out and count and interview homeless people on one day in January. Is it kind of like the last Thursday in January? And we start like at 7 a.m. And I was right here this January at the soup kitchen, which was a great place to be because they were open at 7. We sat in the dining room, had nice conversations, asked people questions about how long have you been homelessness? Are you a veteran? All those kinds of data points. They can choose to pass on a question if they don't want to answer it. But we use that information to apply for funds for our community. And so we also track all that data to see how we're doing, where gaps might be, and to inform our strategic plan. That takes a lot of people, well over 300 volunteers, right? And we also modify that questionnaire every year. So if you're interested in that and giving input on that, that's a good committee. SDI is systems disparity.
Inequity.
And what?
Inequity.
And inequities. All right, so systems disparity and inequities task force. You can understand what that's about. And we recently changed the name, and we changed the name because of the political climate. That's all I'm going to say. And what it means is it's looking at hard, cold data, and it is seeing where gaps are, and it is addressing them, regardless of color, age, sex, whatever. What the data shows is where we're going to focus. And where there are inequities, that's where we're going to try to find out why and how to address them. So if somebody's, set off by a certain words, this is what this one is. And that's why I didn't roll off my tongue, is because we play games with names. And then the Youth Action Board is one for people who are under 24. Thank you. Under 24. And this one isn't really robust right now, is it?
No, currently this is really folded into the Lived Experience Advisory Committee's activities and will hopefully reemerge as an active independent group once a larger youth group is kind of formed within that. Yeah.
And I know I am a guardian ad litem and have been a guardian ad litem for teenagers before. And, they age out of foster care and, where are they going to live? And so there's a lot of times that can be a focus of a youth advisory board, young adults who may be thrown out of their house or whatever the reason is. So, these are our councils and committees. I would encourage you, I would love for each one of you to join. You are welcome to attend any meetings, all the meetings, see where you fit in. And don't worry about any fee to join. We can take care of that. There are scholarships and people can donate to help cover that. But if you join, we need you at the table. Make every effort to attend because your voice and your experience and what you bring is very important. The more diverse voices and engagement and ideas, creative ideas that you can bring to the table, the better. And I think, as I said in the beginning, it's one of my goals, is to engage more of the faith-based community in the continuum of care. You think about the different congregations that are throughout our county. As I've said before, if each one would just, metaphorically adopt a family or a person and help them along their way, I think it would make a huge difference. So more to come on that. But any questions about all that stuff? Okay. All right. So we're going to turn it over to bridging service gaps through collaboration. How are we leading this, Sherry?
Oh, wow.
Are we?
Do I need to?
Yeah, you can come up with me.
And everyone, so this is gonna be a breakout activity, and we have folks, I don't know how many people we have online. 18.
18 online. Woohoo!
That's a large group online, if they can go into.
Yes.
Okay, good. And I'm happy to have the instructions. You have instructions, very good. Okay, so we're gonna break up into groups of 4 to 6. Very small groups, and if we're able to bring the chairs back together again at the very end, that'd be very nice as
Thank you.
well.
So again, Sherry's the interim CEO of the HLA. She's doing a fantastic job. So they're the ones who are doing all that groundwork with the Homeless Leadership Alliance, our lead agents.
So for the session, we'll break up into 4 to 6 people per group, and if you can get kind of like in little circles so that you can talk with the neighbors around you. And the questions, they'll be guided. I'll hand out, or we'll have somebody hand out a piece of paper at each group. Your job will be to delegate one person to be a note taker. And if you need paper or pen, just let us know. And then another person who's going to be the spokesperson. So that at the very end, there are some guided questions you'll look through, you'll just have a nice informal chat about. And at the very end, we'll harvest all of that and bring it to the whole group with what the key takeaways are from that one, from your spokesperson. The focus of this is to look at what do we have going on? What are our assets? Who are our connections that what are we doing well? And then also, where are some of those gaps that we know exist and who's missing from the table? And by missing from the table, we have several tables here, but missing from this room and from this conversation. And so that we can collect all that information and we as staff can go back and start doing more outreach to bring people back. Okay. So just go ahead and you'll have about 20 minutes to talk, and then we'll bring everybody back and do the share outs. I'll hand out these questions very shortly. Very convenient. Okay. So we do have 3 breakout groups that are online, and we'll make sure to take turns. We have not forgotten y'all. But who would spokesperson for this group? What were some of the key takeaways? Current connections and collaborations that are happening, and some gaps, and maybe potential connections that we may be.
Job has been passed. So, okay. So I'm finished. So that means it's going to take me a little bit longer. Okay. No, I'm just kidding. All right. I'm going to go fast. So question number 1 is services and strengths. Let's go. Emergency services, coal mine services. I did not say that, even though that's what I do. Shared housing, growing housing, medical services such as the healthcare for the homeless, Blue Card, and the dental services. If you haven't been to Bayside, I highly recommend it. PSTA, transportation, access to transportation disadvantaged and low income resources. Workforce availability, training, and passionate citizens. So all of us. Some of the question number 2 is who is currently at the table. We said county and various municipalities, various law enforcement officers, housing authorities, community nonprofits, shelters, behavioral health, faith-based communities, and veteran services. Oh, I'm on TV too. I'm on camera too. All right, and who's missing? We really said that diverse mental health professionals, those in the recovery space, diverse faith partners, aging, senior partners, private funding opportunities, additional law enforcement, hospitals, specifically medical respite, teachers, schools, businesses, including small businesses, people willing to make a change. Oh, and career source and on job-ready services. Partnership, so what partnerships or collaborations are working well? We put, not gonna read my own handwriting, that's why she gave me the paper back. We referenced where we are, right? St. Vincent de Paul, North Pinellas, and that's partnership with Clearwater PD with the street outreach. A lot of the food partners throughout our county and the way they're collaborating with a lot of locations, faith-based community resources. I call them drop-in centers, but locations like here, Tarpon Shepherd Center, Daystar, again, being a hub or a partner location for people, and then the veteran services and things like the VFWs, all those different clubs and committees that support veterans. Next question, what are opportunities for new or deeper collaboration, hospital outreach, teaching, trainings for those case managers, but also other people going into those facilities and then also discharge and things like that. Gap fillers, meaning we have people that can help people kind of get in or access the system, and then they get kind of stuck or lost, and how do they get out? And so there's people that do fragmented pieces, but sometimes there's some gaps that need to be filled in. And direct and compassionate services, so just really amping up some of those. And we're obviously running out of time, so we gotta look at less answers. So what support is needed to strengthen these connections? We said resources like people, people and funding and creativity in that space. Education to partners, to people, to funders, to any community that's willing to hear it, those businesses, those hospitals, those schools, all of that, on who and how to help. Again, creativity in that, and advocacy. There's reference just kind of the change in federal and things that are going on across our state and across our county and community. This continued advocacy and good citizens. So, anything I missed? Okay. I wasn't.
Yeah, that was fast. More than that, so that we can like piggyback, it's already covered, what else?
So my name is Michelle. Thank you for having us here. So she could cover a lot of everything that we were gonna cover. Some of the needs that are here that we feel like could be strengthened are bringing like churches, like we already talked about that, churches and even private organizations, corporations. My boss, he's a big, he wants to bring food pantries to local areas, but that means we would need to rent the space. And because he's tied to the corporation, he can't do that. He needs to attach it to a organization. And so we're always trying to find organizations people work with. So working with corporations, private companies, churches, to kind of get these things going, I think would be valuable. Things that we need also, showers, housing, like shower facilities. I know they do some mobile showers around the area, but just like and they do the showers here as well. So that's amazing. Housing resources and different hear that. And this expansion of the shelter system in Pinellas County, it's like really rough. The shelters we do have are, a great start, but there needs to be a little bit of maybe compassion. If you ever actually had to stay there, and you would probably not, you'd rather not. They're not always safe or clean, but it's an emergency. It's better than going to jail. So some things, I'm not really looking at the questions, so forgive me. Some things that we could that could benefit people is training for essential jobs, job training, and so that when they do get out of on their feet, they can afford to actually make a rent, somewhere. Financial literacy as well, so you're not spending half your money on fast food or whatever it is, that can help. Also, there's a need to connect with technology. They do the free phone services, and they used to do the tablets that got cut, so now it's just the free phones. Because we need those sorts of things. And one of the strengths in the area is we do have a lot of food pantries. So that is one of our strong points, and a lot of mobile food pantries, like St. Vincent is doing those mobile food pantries because people, sometimes it's a distance to get to that one location where you have it all. But they're reaching out to more different areas, so it makes it a little more accessible. But yeah, they said a lot.
Right, so. So we have multiple people with lived experience and multiple providers in our group. So some of the community strengths, we felt VA services, healthcare services, Pinellas Hope and HEP are strong, shelter rehousing programs, though beds are limited. Pinellas has a lot of programs overall relative to other areas. Quality employment, support and behavioral health resources don't seem to be connecting to those who need them. As far as a seat at the table or, represented here, we feel that, the youth, and the faith community could have, seats here. And private businesses should have a bigger presence in, CoC efforts. And we feel we need more boots on the ground, outreach workers who are not necessarily attached to formal programs to act as essentially case managers for those not in informal programs. We can have all the resources and services in the world, but there are often barriers that prevent folks from keeping appointments or assessing services. We need 10 Kathy hands. 3 agents, case managers, provide guidance and support for the unsheltered. We also believe there's greater potential for group share or rent sharing initiatives, but we recognize the significant amount of obstacles often involved with those situations. So that's all we have.
Thank you. Now we're gonna go online.
Thank you. I'm gonna remove this spotlight and, hey, everybody, on my face. All right. Sorry, I need to turn this camera on. There we go. That's good. All right. Now, if we could please get group 1 online to share their findings. And hopefully that should remove my photo.
Hi, my name is Walls. I'm actually with the Hillsborough County CoC. I was invited by Victoria and Megan to attend, so thank you so much for having me. I'm chair of our outreach committee, and I lived experience. I lived in actually Pinellas County for 45 years, I believe. So I did take some notes. I'm going to kind of bounce around if that's okay, but I'll make it quick because I know that time is short. So, we talk about affordable housing, but what we need is income-based housing. And I think that if we can get away from the word affordable, because like the young lady mentioned earlier, what's affordable to me is not affordable to you. But if we use the term income-based housing, knowing that no more than 30% of your income should be used for housing, we may be able to leverage that with some of our developers to, make these type of housing programs available. Something else that we mentioned about, getting more people, some of the barriers, like with the hospitals and private businesses. I heard that you have some of your municipalities that are not, really on board. But I think what needs to be done is to educate, is to let them know what's in it for them. That if, your local Wawa has an issue with the homeless, kind of hanging around, well, they've got a bunch of trees or different things. Let's educate them about landscaping. Let's educate them that by coming to the table, you're going to be a part of the solution, as well as your municipalities. If somebody gets, run off from Largo, they're just going to go to Pinellas Park. And if Pinellas Park runs them off, they're just going to go to Seminole. So we need to educate the municipalities that if we all work together, we're so much better. But they may not understand that. They may just think it's a Largo problem, or it's a St. Pete problem, or it's a county problem. No, it's all of our problem, but we need to do some education on that. And then, the same thing like with the hospitals is, making sure that their administrators are at the table because their administrators may not even know what's going on. When we've got this patient dumping, we can't have that. So I think education is key. But like I said, I know that we're running short of time. But thank you for having me today. I appreciate it.
Cindy, very good points. Appreciate that. Breakout session number 2. Do you have a spokesperson? And if you could, since we are running low on time, just piggyback on anything that has already been stated. If you have anything extra to add, please share that.
Can you hear me? Kate, she made a good comment. She's an occupational therapist. I don't know if it's already been said because it's a little hard to hear, but she talked about when people have, surgery or they come out of the hospital or they've been injured in that time frame when they're homeless and they need to go from to be like, let's say you get your gallbladder out and you still have to, you're done, you're released from the hospital, but then again, you have to turn around and someone has to take care of you. They got to make sure you don't run a fever in case you have an infection, things like that. So she was saying there's not enough shelters that offer this type of service for people that they're working on their patients to release where they can be in a safe location. Kate, I'm sorry, you can go ahead and chime in if I misspoke or anything.
It's the medical respite care. I think that was
Yeah.
echoed by someone else. Yeah, shortage of that.
Okay.
And we definitely have a hard time with safe discharge plans where I work.
And everything else was pretty much the same. They also talked about, my group also talked about, I know there's resources, but I guess when they were saying it, I was picturing like organizing the resources. I know we have 211, but sometimes they were saying it takes people a long time to apply, or they don't have the technology or the cell phone or the proper apps or the know-how to do that process. So, and I know we have people that we work with the city of Clearwater and stuff. So maybe something, I don't know, universal that makes it easy for everyone, even somewhere like go to one location. And if you need any apply for Medicaid or kind of like what they do with when you're looking for a job, you go to the Career Source Center, and you have that one location where they work on resumes and all this stuff, maybe something like that to help people where they have caseworkers there. And I don't know, I'm thinking kind of big now, so I'll be quiet.
Thank you.
You're welcome.
Breakout room number 3. Did you have a spokesperson?
I ended up taking the notes, so I guess I'm the one presenting. So strengths, we talked about really meeting people where they're at, getting to really hear their stories over time out in the community. Definitely was a strength to have meetings like this to allow us to collaborate. We talked about just gaps in locations of services, that it's not consistent, provision of services throughout the county. So on an action item was really kind of what others people said too, kind of centralized front door, whether it's by phone and or in person, and also continue those like information. We used to have the yellow books. I don't know if they still come out, but something you can hand someone if their phone dies, at least they can take that with them in that moment. And when they get hooked back up, they can, call and have that information. We talked about, so this meeting, it was great for collaboration, but one of the things we saw as kind of a weakness of it is with the timing being after work, the frontline workers that may need information about the different services and things we're talking about on here may not be able to attend. So maybe finding a way that because this has a really good group that doesn't necessarily attend our other like funders, providers, council meetings and stuff too, but maybe a good way to share the resources with frontline staff too, not just people on the councils. Talked about difficulty and weakness keeping families together when a person spoke about pregnant women with their spouse or significant other, and they're really hard to find a place to put both of them together to keep that family unit together, which is important for their longer term stability. So back to our action items, definitely that centralized front door, additional coordination, like someone mentioned, between fire, EMS, hospitals, medical discharge, and that kind of thing, really looking to expand that collaboration, and looking for more of those family shelter supports and those job connections to get them back on their feet.
Very good. Thank you, Vera. So I'm not going to try to encapsulate and summarize everything that was just stated, but what lots of workforce development, faith-based community members, small business owners, large business owners, corporations, getting more people to the table here. If you know someone, here's the call to action. You've heard this list. We have the list, and we're going to be following up and making that part of our marching orders here. But if you know someone, the best way to get someone involved is to personally ask. I know Gary can tell you that, and the other Gary, and Mary, and Jennifer, everybody. Okay. But that's how people get involved. Personal experience, directly been involved because of a family member or yourself, or because you love somebody who is involved, right? So if you have a connection already, please reach out to that person or reach out to me. I will have my cards over. Reach out to any of us. info@pinellashomeless.org. It'll still involve us. If there's a specific contact that you want to make that introduction, we would really appreciate it, because that is the best way to get people involved, rather than my cold calling them and then saying, "Who are you?" Right. So that's the next step. Thank you.
I don't know if I was the only one, but I tried to become a member and I got an error message on your website.
Well, if you wouldn't mind seeing me afterwards, we'll work on it together.
Thank you. That was super informative and lots of good ideas. So we're here in the agenda part where there is Q&A and comments. Anyone have any questions or any questions, comments? Resource sharing? Do you have any resources, people here that are involved in different organizations that we haven't touched on, or that you'd like to share what you do in our community? Please feel free. Yes, here. Like Oprah, right? Did she walk around with her own, I don't know, down here, I will.
I'm Jody with Disability Achievement Center. We're the Center for Independent Living. We serve people of any age and any disability. The couple brother-sister duo that Kathy was talking about, we're helping them. We're working with them. We are most known for providing durable medical equipment, walkers, rollators, wheelchairs, you name it, we provide it free of charge. We also provide incontinence supplies and nutritional drinks, because all those things can add up and keep someone where they are. We serve those with a disability. We're not asking for medical diagnosis. We don't want the 40 pages from your doctor saying, yes, you have a disability. We're going to believe you, because if you come to Disability Achievement Center, you need our help. Just like if they come to Continuum of Care, they need your help. And that's how we treat it, and we just keep moving forward. So we're a strong resource, and we'd like to, if there's anybody that needs our help, reach out. Jody Armstrong, Disability Achievement Center. We're located on Belcher Road in Largo, 12552. So we're just south of Omerton, north of 102nd, O'Brien Dairy.
I'm sure you take donations, financial or otherwise, if needed.
Yes,
Do you?
We're able to do the medical equipment because we get donations of medical equipment. So if you have anything taking up valuable real estate in your home, please let it go and give it to us, and we will,
Like a walker?
if you need something, we will be happy.
Donate, did you? Jennifer.
I would like to know, come up with a plan of how we can better get the word out about the Pinellas County Continuum of Care to the residents of, like whether it's on the radio. We talked about that at our meeting on Thursday. Because we need the people to know about it. and get that information out there, because there are people that would be willing to become a member or might want to. So how do we like in mass production, get that information out?
I thought about that too. What if we developed like a 5 to 10 minute presentation, and a group of us went to each municipality during a council meeting and gave a 10-minute presentation. So we have 24 municipalities, and some of them are pretty tiny. But if we got a group of like 10 people and just 3 of them chose a meeting, and you rotate and go around and just introduce ourselves and say, we're the CoC. We wanted to share this about you. You know, I would think a good time to do that would be maybe late summer through Christmas time or the end of December, because those municipalities are going to be looking at their budgets in January. And so if we present who we are, what we are, and an ask, consider us when you're developing your budget in January, that might be good timing. And, you know, with it being May, we could spend May, June, July kind of looking at the schedule of their meetings and figuring out who might want to do something, developing a presentation, and then getting that going. And that might be part of an advocacy group task. So I know you'd be right there with me. You've spoken before the councils before. Yeah, that'd be good.
I think it might be a good idea to, if we talk about municipalities, to attend a big C meeting.
Yes.
Island Government Council. That's where the 10 beach mayors get together every month, the last Wednesday of the month at 8:30. It's a moving meeting up and down the beaches. Everybody hosts one. But that would get the ear, especially on the beaches, the councils have just changed over the commissions. So they need to know who we are and what we do.
I want to add to what you were saying. I had that same idea, but what you were saying, I mean, we're all, each have probably a Facebook page, a social media platform. You know, we need to know who each other are, how we can get in contact with each other. And that way you have that connection. Because what your guys are doing is not necessarily going to translate to, but, you know, I'm going to be doing so. When you get it out there and, you know, just, hey, pay attention. And we've got a lot of people coming in from all the other states, so we're just gonna have to re-educate again. It's an ongoing process. So just, you know, do the social media, that's your advertising platform to get it out there. And that's just a constant.
Yeah, I was just gonna say, personally, I'm pretty choosy with my Facebook friends list, but our organization has a couple thousand followers, mostly based in Pinellas and Pasco counties. So I'm sure we have at least 1,000 Pinellas-based followers, and I'll be happy to throw up a little, you know, blurb about the CoC. Not only does it get the awareness out, but it kind of shows our organization sort of endorsing what we're doing, which we obviously do. So I think that social media, especially if you're able to do that with your organization's page, can be very effective. And I would just say, again, that I work for the Recovery Epicenter Foundation. I just wanted to say a quick word about our services because they helped me get off the streets in 2018. We have a no-cost respite center, one in Clearwater. We also have one in Newport Richey and Pasco County. But the one in Clearwater is right in this neighborhood. It's called the Catcher's Mitt. Like I say, it's no cost. We averaged 19 days for a length of stay in 2024 for our participants. Because we are no cost, we get a lot of people who are coming off the streets, and we are facilitating connections mostly to sober living or treatment, depending on what level of care they need for their substance use disorder. We also facilitate referrals to like HEP or Pinellas Hope, and especially in those situations, we try to provide peer support. When I say peer, I mean people with lived experience. Our entire foundation is people with lived experience in recovery. We try to provide peer support to people both before and after they are in our program, in our respite center. So, you know, Wednesdays and Sundays, I'm over at HEP picking up a couple of guys and taking them to meetings with me, We try to continually provide that support and really bring people into our recovery community. Which again, I mean, saved my life. So I'm not just a shill. I really believe in what we do. And I just thought, if you give me the chance as our outreach director, I have to say something. So it's Recovery Epicenter Foundation. Our Facebook page has a lot of good info. And if anybody knows of anybody who needs to get off the street and get into a sober, structured program with a lot of really good help, you can see me up there.
Yeah, just make a list of who everyone here, get their emails, get their phone numbers, their websites, whatever it is.
Well, we've got your email. We can send out, minutes of the meeting and share those resources. Sure. And
I'd like
yes.
to give a shout out to, I would like to give a shout out to the Disability Achievement Center. And my journey as a medical social worker, I call you guys all the time with some of our older adults that we were working with. But I'm here for Golden Generation Incorporated. I like to talk about our 3 arms of love. You want this? You want around this? Oh, I'm so, okay. So, Golden Generations Incorporated, I'm here with some new members of my staff, Kay Haynes and William Stewart. And our 3 arms of love is that we work with foster youth, particularly those who have aged out of the foster care system. We have a home for young women called My Sister's Place, and we provide housing for them, supportive services, teaching them life skills. And we also do career development, entrepreneur training for youth in our community, 16 to 21. We pair them with seniors in our community so they can mutually support each other. We have a grocery shopping component for that Senior Connection Grocery Project. We have a Senior Connection Homemaking Project where we pay our youth to go in and clean the homes of our seniors in the community. So a little bit about Golden Generations and what we do in St. Petersburg, Florida.
Amazing. Like that intergenerational learning. That's amazing. Anyone else want to share resources or any comments online?
I'll say one more thing.
I also want to give a big shout out to the Disability Achievement Center. I had to learn how to walk again 6.5 years ago after a major crash. I called Jody and she helped me so much. I was able to drive and that was amazing. So thank you.
Well,
That's great. This is how we get people to come. We just gotta tell everybody how great you are, and then you're gonna go back and you're gonna say, oh my goodness, y'all gotta come to the next CoC meeting. So there's a few resources that I want to share. The first of them is that next week on May 19th, we have the last of the CoC's Trauma-Informed Care Training Series. You might have been a part of this last year. We had a 5-part series of training scheduled. We got through 4 of them before these silly little hurricanes came through. And we never really got a chance to reschedule those because we were all so rightly focused on hurricane recovery. That being said, I think that after all of that, this is a really good opportunity for everybody to take a deep breath, come together and join this training opportunity. These sessions, the 4 that we've had so far, have been a great opportunity to learn more about being trauma-informed and empathetic and knowledgeable when we work with clients and members of the community, but also when we're working with our colleagues and when we're looking at ourselves. We did a whole session as part of this trauma-informed care on compassion fatigue because burnout is very, very real, whether you are on the street or you are, working and helping folks experiencing homelessness, or if that happens to be both of your situations. So it's really, really important that everybody have this opportunity. So CoC members, your staff, your volunteers, your friends, have them join this virtual training. It's open to the community. Our partners at Affinity, which is a program of Metropolitan Ministries, are the trainers. And the sessions really have been great so far. There's no cost to our CoC members. So please go ahead and register for that training. It'll be virtual on the 19th. So there's that. I also want to make sure that everybody is aware of this little resource here, the Interacting with Law Enforcement pamphlet. So this was from our Lived Experience Advisory Committee within the CoC. Our LEAC members really figured out which one we're landing on there. Put this pamphlet together to ensure that members of our community know what their rights are and have the best practices on hand when interacting with law enforcement. This is not a legal guide. We are not giving people legal advice, but there is some good stuff in here, like know your rights. There's information about the Miranda warnings, about reporting, things like that. Just a few resources, a little bit of information about the anti-camping law and all of that. It is available on the CoC's website, and we've also printed a lot of these pamphlets here, so go ahead and take as many of those as you want. Last but not least, we are in the process of updating the homeless resource guide. So if you have updates to that, if your programs have updates, please let us know. And if there are programs and resources that you're aware of that are not currently included in that guide, also, please let us know. I can't add things to the guide if I don't know that they exist. So please let us know what you know, and we will work on that update. We have a few of the guides out front. We also have these 24-hour resource cards here. Please feel free to take them. And we have these little flyers that the Anti-Camping Response Task Force put together that, again, have a few resources for our friends on the street, just so that everybody knows what's going on within the community. So there's a few things there for you. If you have any questions, please let me know.
Thank you. There are lots of resources. Yeah.
Sorry, your announcement reminded me of an announcement I should have made, but on June 2nd, it's on the HLA calendar, is the hurricane season kickoff meeting. So I know we just ended, but here we are again. So June 1st is the start of the season, but June 2nd at 3 p.m. there is a virtual season kickoff meeting. And it should be posted on the calendar. I don't think I've seen it in the newsletter yet, but be mindful of that. Pinellas County does help coordinate the evacuation of all the hurricane shelters and communication with our outreach teams and different locations like that. Majority of our homeless shelters are in A/B zones, so if an evacuation is called, most of the shelters do have to transition all of their residents, just like the mobile homes and all of those others in low-lying areas. So we give a lot of that information, which I know may be fresh from last year, as well as some of the programs and how they evolve. So we'll be hearing, I think, from the HLA as well and how they're coordinating with outreach and some of the other community programs. So shameless plug, thank you.
Thank you.
Thank you. Thank you very much. All right, again, thank you all for coming. It's great to learn about your programs, have great ideas, thinking about outside the box. Your programs are amazing. So thank you all for being here. People with lived experience, I appreciate you being here. Your voice is critical. And people online, thank you for attending. And thank you to the HLA staff for your leadership and organization. We really appreciate that. And there are lovely treats up here. I can't get this one open, but oh, there it is. Take a treat on your way out. Thank you very, very much. Have a nice evening.
There.